Well, you may remember pop singer Rihanna recently tweeted a picture of herself hooked up to an IV drip. She was reportedly getting an energy boost. That's the first time many of us had ever even heard of IV therapy. But as more celebrities reportedly use the drips, IV therapy has taken on the sheen of glamour, both expensive and excessive. And it's not just a Hollywood trend. It's also one that's growing nationally and locally, too. The Fox 12 investigators wanted to know, is IV therapy good for you? Most of the folks who come to Lake Oswego's Center for Traditional Medicine for IV therapy come here for more than an energy boost, though for some, it's all about the boost.
So you're going to Chile?
Businessman Matt Curry travels nonstop. He comes for an IV boost about once a month, but he says if he had the time, he'd sit for the 45-minute drip once a week because he says it works.
So you just have a natural sense of energy.
But isn't this just a quick fix? Why not just eat right and get a good night's sleep? Well, Matt says he does, but he says he needs more. His naturopath gives him extra vitamin C, B complex, and magnesium.
It's very common for people who are burning the candle at both ends, busy executives, busy individuals in our society, to become run down not only energetically but nutritionally.
Dr. Peterson says you could never take enough vitamin pills to get the amount of nutrients that you can get through an IV.
Their energy pops back and they're restored.
I mean, at the end of the day, you have the energy to play with your son or daughter and be alert at the table when you're home from work and things like that.
Our approach to using nutritional IVs is to support the immune system.
Dr. Peterson says poor nutrition is at the heart of many illnesses, and by receiving mega doses of vitamins and minerals in drips, you can help prevent, treat, and cure problems ranging from fatigue, migraines, viruses, even perhaps cancer. The IVs typically are filled with high doses of vitamin C and B and trace minerals. Dr. Peterson says he does a lot of lab work to discover the particulars of the patient's condition, and then uses that information to decide what the patient needs more of, whether it's more vitamin C or the addition of magnesium or various amino acids. Some in the medical establishment deride these IV drips as nothing more than trendy party girl drips. And while the trend is growing for these quick fixes, in reality, most of these fixes aren't quick. In fact, they often require several visits a week over many months.
These are nutrients. Yes.
The treatments range in cost, usually from $75 to $250. Insurance does not cover these treatments. It is all out of pocket.
They are costly, and yeah, it's worth every single penny.
40-year-old Laura York suffers from a rare form of liver cancer. She's had regular chemo, but supplemented that with these vitamin IVs.
Those nutritional IVs that I would get on the off weeks of chemo were, in my opinion, the only reason that I was able to be healthy enough to withstand 2 years of chemo in the first place.
Laura still comes in regularly for IV drips of high-dose vitamin C, and in fact, many regular MDs think that makes sense, that high doses of vitamin C may be a good cancer-fighting treatment, though there are no long-term studies that prove that. And while IVs are a routine part of treatment in hospitals and clinics, the medical establishment says the growing use of IV therapy may do more harm than good. More on that tomorrow. Yeah, tomorrow at 10, we're going to talk to a local doctor who says anytime you get a needle in your arm, whether it's in a hospital or a naturopathic clinic, you risk infection, and some of those infections can be serious.